Good afternoon, everyone. Welcome to our kickoff day for our 5th annual McLean County Behavioral Health Community Forum. This is our 2nd year of doing this virtually, and this year our event coincides with the start of Mental Illness Awareness Week, and find it very timely to make sure that the forum that was intended to help educate our community, reduce the stigma surrounding mental health, and really raise awareness about resources, coincide with this particular week and remain in the month of October for consistency, so that people begin to recognize that this is when the forum will occur each year. This idea originated out of the Mental Health Action Plan in 2015 to meet the goals that we just talked about. And we have been very fortunate to see an increase in attendance each and every year and reach more and more people. The idea being that over time we reach even more. Some quick overviews. I am Tricia Malott. I have served as the county's Behavioral Health Coordinating Council Supervisor for the past 3.5 years, and I'm helping kick off this year's event. Today's session is a panel discussion about some of the McLean County initiatives that are making a difference in people's lives and directly relating to how we all care for one another. So that will be the theme that carries through each of our discussion points for today. A few housekeeping notes is that we do have several panelists for today, of which you can see all of us at the moment. So if you have a question at any point, you can use the question feature in your toolbox on the side. And if it's for a specific panelist, please identify that as part of your question and make your question as specific as possible, because they will be read at the end. We have a lot to talk about in our next 90 minutes, so I'm keeping my introduction a little bit shorter than normal. And you may also find that some of us give very quick overviews, and you may want more information. And so one of the things that I think we're all going to make sure we do is to share how to get in contact either with us or how to get involved with something. And then the last piece is that in the handouts with this webinar and with all others, there are some information pieces about upcoming mental health first aid trainings. There is a handout and document put together that the planning committee and panelists and presenters provided feedback on tips to take care of your own emotional well-being and those around you, or ways to get involved in the community. And then there are some resource documents shared from PATH to better serve you. Additional forum sessions can be found on the county's website under the Behavioral Health Department for events. And we hope you join us for more of our sessions between now and mid-November. So with that, I am going to hand it over to Susan Schaefer, who will start our discussion and help introduce each one of us. And tie all of these initiatives together. So with that, Susan, it is all yours.
Thank you, Tricia. And I'm Susan Schaefer, and I am on the county board. And with us today is Sally Gambacorta from Carl Broman, and make these in order, Nona Waller from Center for Human Services, Colleen O'Connor from Project Oz and NAMI, and Michelle Lamboli from Unit 5, and Angie Chesensky from, I got that right, Chestnut. And so each one of us are going to, and then Tricia, as in her role too. Each one of us are going to give a short overview of our programs or what we're working on. And then we'll have some questions for them to expand on some of the things that they've talked about. So for me, some of you may not even know we have a mental health action plan. So I want to start out with a little background on that. Back in 2013, the McLean County Board was looking at solutions to help those individuals with mental illness who were incarcerated in jail. And a report from the National Institute of Corrections was very critical of the community services once those people were released. So that led to the chairman at the time to appoint 2 board-led groups, one looking at needs and the other one looking at best practices, that included about 70 individuals And that resulted in the 2015 Mental Health Action Plan, which is on the county's website. The plan represented systemic change needed to how services are delivered in McLean County. Instead of spending money cycling people with mental illness through jails, hospitals, homeless shelters, and other ineffective alternatives. So counties throughout the country are leading this type of change. McLean County is part of a data-driven justice initiative led by the National Association of Counties. And we continue to work with our peers in the DDJ arena to learn and share our experiences to bring about change to behavioral health systems, and not just in the justice realm, but within our communities. So it's been 6 years since that plan was written, and many things have occurred, not to mention a global pandemic. I was asked by Chairman McIntyre to lead the effort to update the plan, which is I'm working on, and it's hopefully will be completed soon. It'll be a fairly comprehensive look at where we were, where we are, and ways to look towards the future. This was not and is not one of those studies and plans that gets put on the shelf. The plan is a living document and serves as an overarching roadmap for change. So the 2015 plan was divided into 5 very broad sections: collaboration and coordination, crisis, youth, housing, and medication medical management. And they were independent of each other. But we have realized that some of the action items that were in there could be standalone. But the update still has those sections, but will show the interconnectedness and the complexity of the mental health system. Some sections have been expanded with a lot more detail, and new topics have been introduced, such as older adults and diversity, justice-involved individuals, and more. And then we've had data that has been gathered, and they will still show where gaps and needs exist because it's not done. Finally, we'll outline some action steps to be taken to address some of those gaps and needs, and utilizing new and innovative programs and ideas. Tricia had already mentioned that this forum, which is now in its 5th year, was one of those recommendations, and it helps to bring community-wide awareness and reduce the stigma around mental health. And some of the other county-wide initiatives are what our other panelists are going to be talking about today. But there's still much more to do, and there are no quick, easy, or perfect solutions to changing the system. We're all in this together, and by caring for each other, we are making a difference. So with that, I'm going to move on to Sally Gambacorta, and she is going to talk about the Community Health Needs Assessment and the Community Health Improvement Plan.
Great, thank you, Susan. So as Susan said, my name is Sally Gambacorta. I'm the Community Health Director for Carl Broman Medical Center and Carl Eureka Hospital. And I'm going to give you a brief overview of the Community Health Needs Assessment, or CHNA, and the Community Health Improvement Plan for McLean County, or CHIP. So a CHNA is something that hospitals are required to do once every 3 years, according to the IRS. So we began doing our first CHNA in 2013. Both hospitals did it separately. We collaborated, however, with the health department, because health departments for years have done a community health needs assessment, more commonly referred to as an I-plan. They're required to do it once every 5 years, however. So they shortened their timeline to meet the timeline of the hospitals so that we could do a joint CHNA, which we started doing in 2016. And our most recent CHNA is our 2019 CHNA. So a joint report is really important. It's much better than a collaborative process or collaborative CHNAs, because we look at the data together, we select the 3 health priorities for our county together, and most importantly, I believe, for our residents, for our human service organizations, is that there is one report. So if you look on the website of the health department, OSF St. Joe's, Carl Broman Medical Center, and Chestnut FQHC, their family health center, you're going to see the same report with the same health priorities. We look at a lot of data. One of the key pieces of data is that we do a community survey once every 3 years. That survey is actually open right now for our 2022 needs assessment. And we work with our human service agencies, we work with Home Street Home Ministries, because we try to reach out to as many people as we can so we can hear the voices of the underserved or the low income. It's available online in English and Spanish. We also have get a lot of data from the health department, and then we have a large data platform that has ER and hospitalization data in it, and that data allows us to drill down into zip code level disparities as well as other disparities, whether they're age, gender, or race and ethnicity. So the 4 organizations lead this process, but we are not the ones that decide on what the 3 priorities are going to be for our county. We have a McLean County Community Health Council. It's made up of 58 different individuals from 39 different organizations and a wide variety of sectors. So we don't take a narrow view of health. We pull in the social determinants of health. So there are organizations representing faith, law enforcement, of course, health, government, housing. So we want to make sure we also bring in the social determinants of health in the viewpoint of those organizations. So the 3 health priorities for the 2019 CHNA were behavioral health, access to care, and healthy eating, active living. So once the CHNA is completed and the health priorities are selected and we write the report and it's approved by our boards, we then have to work on an implementation plan. It's a 3-year implementation plan. So we're currently in the 2020 to 2022 Community Health Improvement Plan. This plan is also a joint plan, which is very unusual. I've been told from the Public Health Service for the United States that they are not aware of any other communities that do this because it requires such a high level of collaboration, not only from the 4 individuals doing the joint, CHNA and running this plan, but from our, human service agencies and everybody as well. So in order to develop that plan, we set up priority action teams for each of the health priorities. So we have a behavioral health priority action team. That team is made up of key stakeholders and helped set up the goals, the strategies, the interventions, and all of that, and making sure that aligns with helping to support the efforts and strategies listed in the mental health action plan. And with that, I will turn the floor back over because some of those interventions are going to be talked about momentarily.
Thank you, Sally. Next, we're going to have Nona Waller talk about mental health first aid.
Hi. So mental health first aid is an initiative that obviously was started in the community here. It's actually a program that originated in Australia back in 2001, was brought to the U.S. around 2008. It is an evidence-based program that seeks to teach participants, including community members, health professionals, basically anybody, about mental health, about how to help those who are having a mental health crisis, and to help reduce the stigma overall of mental health. We have been teaching it to community members for a number of years now. What's really nice about the program is that not only is there a class that is focused on adult mental health, there's also classes that focus on youth mental health, which can be really helpful because obviously, kids are a little bit different than adults. And again, one of the big parts of that specific program is that it is intended to help reduce stigma, promote education, and it is evidence-based. We hold classes available to community members throughout the community. We also work on educating people in various school districts, faith communities, different places like that can request to have someone present to them on these topics.
Thank you. Moving on, we'll go to Colleen, and she's going to talk about ending the silence.
Thank you, Susan. So I'm Colleen O'Connor. I am the lead prevention specialist at Project Oz. I'm also the executive director of our local chapter of the National Alliance on Mental Illness. And I run NAMI Ending the Silence, which is McLean County's youth suicide prevention and mental health education program. So this is another education program like Mental Health First Aid, but while Mental Health First Aid focuses on providing education to adults, Ending the Silence focuses on providing education directly to young people. So this program was designed by the National Alliance on Mental Illness, and in McLean County, we deliver this through Project Oz as a partner program with NAMI Mid-Central with funding from the McLean County Health Department. As I said, this is also evidence-based, and we started in 2016 with just a couple schools and then expanded to all of the local standard public middle schools and high schools, which is about 3,000 kids a year. This is a 1 to 2 day program, usually in health class, and the primary goal is to reduce youth suicide and improve youth mental health by providing information and reducing stigma. So we spend a lot of time focusing on how young people can recognize and respond when someone in their life is struggling. We know that a lot of young people, even in normal times, struggle with their mental health. About 1 in 5 young people struggles with some kind of a mental health challenge, but especially now, so many of our young people are having a hard time. So we want to give them the information that they need in order to take care of themselves, but also to take care of their friends. We spend a lot of time also talking about what you should do if you're concerned about a classmate or a teammate, a peer, a friend, family member, anyone like that. So we share that information about how to recognize those clues and what to do, but there's also a strong focus on reducing stigma, because we know that stigma is one of the main reasons why people don't reach out for help. And it doesn't really help to have information if you feel afraid to reach out. So one of the key components of Ending the Silence that makes it special is that it focuses on personal stories of hope. So people who teach, like me, all have some kind of lived experience with mental illness and talk about those experiences in order to let kids know that it's okay to have a mental health challenge. It's not the end of the world. There are other people who understand what that feels like, and there are ways to get support and start to feel better. We also share resources with all of our students. So we learn about resources at school, such as school counselors, but we also talk about community resources like Path Crisis Center, the Center for Youth and Family Solutions, Center for Human Services, and some national resources like the Crisis Text Line and the National Suicide Prevention Lifeline, so that students know what to do if they start struggling. And then another cool thing is that it provides immediate opportunities for intervention. So at the end of presentations, all students fill out a survey that gives them the opportunity to share whether they're concerned about someone. So they have the option to mark whether they're concerned about themselves or a friend and whether it's an emergency situation. Then the school staff and guidance counselors check in with those students and provide support. So in general, about 10% of our participating students reach out for support and are immediately connected with resources, which adds up to a lot of kids. So the real goal here is to let kids know that it's okay if things are hard. There are things that we can do together to make things a little bit easier, and that they don't have to wait for things to get really bad. They can start getting support immediately as soon as they notice those warning signs. And because this reaches so many kids, it also reaches their families. They have information they take home to share with their parents, and it causes a real ripple effect in terms of how many people end up receiving this information. And I'll turn it back to you, Susan.
Thank you, Colleen. Next, we're still on youth, and we're going to go to Michelle and talk about embedded schools.
Thank you. I'm Michelle Lamboli. I'm the Assistant Superintendent for Unit 5 Schools. And the Embedded Schools program is what I wanted to share a little bit about. So this is a partnership that allows for us to have a counselor embedded or available within the schools. So we had a long-standing partnership with Center for Human Services, where they were supporting our students and families, and this allowed for another layer for it to be right there in the schools. It actually started in the rural schools, where it was more difficult for families to get the services, having to come into town to get those. So it started in that fashion, and then through the Behavioral Health in Schools group that was collectively meeting as part of the action plan, it grew into also being in Unit 5 and in District 87 here. And it allows for us in Unit 5, it allows for 4 of our schools through grant funding to have a counselor embedded and available every day at our schools for the students and the families. And the really unique part about this is that it allows for those services to be coordinated with our existing school staff. So it's a lot of collaboration between the school staff and the outside counselors. And for us, what's been most beneficial is oftentimes our families, we know their needs extend beyond our school hours and beyond our school calendar. And so having this support available outside of that typical school calendar has been hugely beneficial for everyone. Referrals for the program happen through a combination of things. It is through what we call problem-solving teams. So it's teams making recommendations, but it's also through those conversations with parents of things that may be happening at home that are carrying over into school. And so it allows for a lot of collaboration between the embedded counselor, the school staff, and then work with the families. So we've seen significant need, obviously, over especially the past year, transitioning from full remote learning to hybrid and back to remote and then back to in-person. So we've seen a significant increase in the needs for our students and families. And so to be able to have this person that's working so closely with the staff and working with what's already happening in the school has been something that we've found great benefit from. And I know for District 87 as well as the rural schools who previously had it.
Thank you, Michelle. And next, we're going to have Angie talk about ROSC, which is recovery. I'm not even going to go there. I'll let Angie tell you about it.
I'll take it over. Thank you, Susan. So Chestnut Health Systems is the fiscal partner for the Recovery-Oriented Systems of Care, or the ROSC grant, which is a bridge from treatment to community recovery supports to sustain one's chosen recovery path from addiction and or behavioral health afflictions. The ROSC is not a treatment entity, rather it's a connector of community sectors. Through collaboration with different community sectors, we create activities and events for recovery education, recovery recreation, recovery living, spirituality exploration and acceptance, support groups, stigma reduction events, and messaging. We also create channels for those afflicted by addiction to find recovery through human connection and tangible community supports to reduce recidivism, crime, and maladaptive behavior. We have public ROSC council meetings to define the action plan and direction. We are trying to increase affordable housing for all McLean County citizens. We are proponents of education and acceptance for multiple spiritual and recovery pathways. Recreation activities to increase community inclusion, acceptance, and develop healthy relationships. We've launched a reentry council to eradicate some permanent punishment and stigma, racial diversity and recovery. We have financial assistance for Heartland College's Recovery Support Specialist Program. And we also have a ROSC YouTube page for personal testimonies and opportunities for community members experiencing any kind of mental, behavioral, substance, or emotional afflictions to feel connected, to decrease the isolation, and maybe they might catch a video that will motivate them to reach out and ask for help. So research has uncovered several interconnections between health and environmental and social factors. The ROSC strives to address intersecting inequities, to address social and environmental factors, creating structural barriers to meaningful and sustainable change. The ROSC is a collaborative effort with McLean County Health Department, Bloomington Library, Recovery Community in general, Center for Human Services, Children's Home and Aid, TASK, which is the Treatment Alternatives for Safer Communities, Prairie Pride Coalition, the NAACP, Prairie Legal Services, Bridgeway, ISU, Heartland, City of Bloomington Township, and PATH, and Joy Care Center. So if anyone or any other entity wants to become a part of the ROSC Coalition, I'll let you know at the end how to reach out to us.
Thank you. And Tricia is going to talk to us a little bit about the trauma-informed and resilience-oriented initiative.
Thank you. So the countywide trauma-informed and resilience-oriented initiative is a newer county project that falls under the Behavioral Health Coordinating Council as an oversight entity. And it is one that most community members have probably not yet heard about because it has been in the planning stages and development of what community messaging will be. But a short synopsis and overview is the recognition that every person has been impacted by trauma, whether it is individually or through a colleague or a friend or a loved one. There is a connecting point to trauma for all of us. When we look at trauma, we can all individually define it. And if you Google it, you're going to find different definitions. But part of our group identified, that trauma is unpredictable. It can create a sense of fear and helplessness, and it can overwhelm your ability to search for coping. And so when we look at it from this bigger picture, it helps make it identifiable to how this can be impacting everyone within our community. So part of this initiative is to have a group of individuals who are the core team to move this initiative forward, to not only define the language that we begin to communicate to the community, but to help organizations understand the role that they play in becoming trauma-informed and resilience-oriented, and how a shift in practices or a change in language can really make an impact on an employee's response to a discussion or how that employee feels, which then can carry over into their home life. And so you can begin to see, so similar to how Colleen talked about, it becomes a ripple effect. So when we make a change in one aspect of a person's life, that can then begin to have an impact in other parts of their life. We know that research shows that when individuals and organizations become trauma-informed, they can become a buffer for the stress and trauma that an individual may carry. Again, we can make a change. So we are beginning to put these pieces together. We being the larger group, are putting together toolkits for different types of organizations so they have a way to know how to begin to implement this. And so that may be a school system, it may be a for-profit large organization, it may be a small business, it may be a social service agency or a healthcare entity. One of the really great things is that there's a lot of evidence-based documentation and toolkits out there based on type of organization and business type. So what we are doing is we are doing all of that research as a group to pull it all together to then be able to say to organizations and our community as a whole, here's where you can find this information, and we can then be a resource for those folks. We know that not everyone will fully understand the impact and how this can play a part. So that's part of why we focus so much on what that language is. But know that this reaches to not only the more urban parts of our county here within Bloomington and Normal, but also to our outlying rural areas, that trauma doesn't just impact one person, and whether it's short or long lasting, it can have a long-term effect. And so we want McLean County to be as healthy and whole as possible. So.
Thank you, Tricia. So there, you've had a little overview now of some of the countywide initiatives that are going on, and I'd kind of like to expand on some things and ask some questions of our panelists here. So I want to start with Sally. And there's a goal of in the CHIP on advanced systemic community approach to enhance behavioral health and well-being. So if somebody looked up the CHIP, they would see that statement. And so how does that goal further the collaboration and coordination section that's in the mental health action plan? Because we've heard a lot about collaboration and coordination, so I'm going to pick on you on that one.
Yeah, no problem. Well, the Behavioral Health Priority Action Team is the group that developed that goal. And believe it or not, we had an 1.5-hour meeting to develop that one sentence because there was a lot of conversation and it was really important, you know, that everybody agreed with it, since this, like I said, the Community Health Improvement Plan is definitely an improvement plan. So that was just the first step in collaboration, was just determining what that goal was. And systemic was an important word that we wanted to add in there. Again, the priority action team, you know, we want to make sure that all of the different entities, it's made up of, I don't want to say all, but a majority of the key stakeholders in our community have a seat at the table. We meet sometimes every month, but typically every other month, not only to discuss the interventions and things in the improvement plan, but anything that is happening that may be new to an agency, and they can share with the other agency, you know, what's working, what's not, or is this, you know, is there a grant coming up? Can we collaborate on it? So it definitely is a lot of collaboration, and the Community Health Improvement Plan as well is a great place to capture all the great work that is happening in our community. And there's a lot of information that helps our human service agencies apply for grants and everything. So yeah, it definitely is based, you know, definitely fits under the goal of the Mental Health Action Plan of, you know, collaboration and communication, because that's really what it's all about.
Thanks. So kind of going on off of that and collaboration and pointing to the Mental Health Action Plan, Nona, with mental health first aid, you were talking about crisis, and you mentioned identifying people in crisis. So how does that apply to what's in the crisis section of the Mental Health Action Plan?
So one of the goals of mental health first aid is to, very similar to your typical first aid CPR training, is to be able to help someone who may be experiencing a mental health issue or crisis up until the crisis either resolves or additional professional help is on site and able to help that person. So in order to do that, mental health first aid focuses on teaching community members, participants, not only how to identify when someone might be having a mental health crisis, but also identifying what they then can do if there's not a professional around, if they are, you know, if they don't feel as though maybe they can address the crisis themselves, what can they do in the meantime? It also focuses on providing resources to those participants, and it is very localized. So for example, when we teach mental health first aid here in McLean County, we are giving people resources including handouts, and names, phone numbers, that kind of thing, not only to like National Suicide Hotline, but also to local resources, PATH, Center for Human Services, CYFS, Project Oz, Chestnut, the Health Department. So not only are people more apt to intervene when there is a crisis because they know what to look for, but it also, they feel more confident that they can help someone who maybe is experiencing a crisis because they know what are some basic things they can do to help. And if they feel as though it's a situation that warrants additional support, professional help, that kind of thing, they know who to ask and where to go to for the extra support in the meantime.
Thanks. I'm going to jump to Tricia. One of the things that Colleen had mentioned, and even I had kind of said, you know, we have a global pandemic here, and the kids are struggling. And so could you maybe say what that COVID would be like collective trauma, and can you kind of respond to that?
Yeah. So I think there are a lot of people who have referred to COVID-19 as a collective trauma. And if we sort of break that down from a definition standpoint, you know, collective refers to a group. It doesn't have to necessarily mean the entire world, although in this case, the collective is the entire world. This is a pandemic that has literally impacted everyone. And trauma, again, is something that can create a sense of fear or helplessness, or that impacts us. And so from a really basic definitional standpoint, COVID-19 is a collective trauma. It has changed our lives for the past 18 months and for an unknown period of time from this point forward. It has changed how we do business. It's changed how we interact with family. It has created isolation for a number of people, either by choice or by health or by proxy of how everything else is functioning in whatever our part of the world is. But it has impacted mental health. It has impacted how safe people feel in regard to a lot of different aspects. So yes, I think when we, in relation to the Trauma-Informed and Resilience-Oriented Initiative, I mean, we're looking at trauma on so many different levels, and it can be an individual trauma. It can also be a collective trauma, and COVID-19 is absolutely one of those potential collective traumas that we look at that has shaped us, that you know, we know that some employers are responding to in terms of how they approach and respond to employees who are either requesting or needing to work virtually, or are struggling with getting a kid back in school and being regulated throughout the day and readjusting to a schedule, you know, knowing that this is having a big impact on everyone right now.
Thank you. I'm going to ask Colleen, how do parents get involved when their child is participating in Ending the Silence, since that is a youth program?
Thank you. So I think that's a really important question, because I get to see kids in school, but then they go home and they're in a whole different environment. And I think a lot of times parents want to continue the conversation. They want to be able to talk about mental health, but they're not really sure how to do that because it can be a difficult subject. So when students participate in Ending the Silence, their health teachers send home a letter that we've created that provides some information to parents to make it a little bit easier to start that conversation. So that letter has information about youth mental health, some of the most common things that their young person might be struggling with. It has information about warning signs that parents can look for to be ready to respond if their young person is struggling. It also has information about local resources, how to participate in youth mental health first aid, people they can contact with questions, and some tips for helping their student cope if they are struggling, especially with stress related to COVID and all of these changes. So the goal there is that when the parent receives this letter and reads it, it makes them feel more willing to start that conversation and say, hey, so I heard that you're learning about mental health at school. What have you been learning about? Can you share some of that with me? So just opening that up and saying, this is something that I want to talk to you about. This is something that I want to hear your thoughts about is a really good place to start, and a good opportunity to let your child know that you're a safe person to talk to and that this is something that they can discuss with you, even if it feels a little bit uncomfortable. And I would say, especially if you do have a young person in your life who is struggling, it's a great idea to take youth mental health first aid. So that's one of the recommendations on that letter is if this is hitting home for you, or if this is something you want to learn more about, sign up for one of those courses so that they can get even more information about mental health and what they can do to support the people in their life.
Thank you. I think that also highlights the fact that how interconnected all of these pieces are in the system in mental health. So, and I'm actually going to go on to Michelle on that and kind of keep on that thread on ending the silence, because that is, you know, something that has a very big impact on the youth. And so what are the embedded counselors seeing, and then what are the other educators, the teachers in the school seeing what after these kids take and have ending the silence?
Sure. So as Colleen shared, you know, having this mental health education, suicide prevention in our schools, you know, we're really helping the students to recognize and respond to those warning signs for a variety of mental health challenges. And a lot of times it's not only for themselves, but it might be for a friend, a classmate, that they're now recognizing what those signals and signs are. So I think Colleen kind of mentioned it, but at the end of the presentation, they get that opportunity to fill out a survey and ask for help, whether that's for themselves or for a peer. And that's shared with our teams, with our counselors, the embedded counselor. And so those the students, again, whether it's for them or for a friend, they now have that opportunity to then have some follow-up with someone in the school, whether that's the embedded counselor or one of our existing staff. And I would say, you know, it ranges. Sometimes it's that individual has shared that it's suicidal thoughts or attempts. Maybe it's panic attacks. Maybe it's just trauma that they want to have further discussion about, self-injury, depression, disordered eating, issues at home. It's very common that through that process of the education with ending the silence, for them to identify, and often it's students that we've not identified in some other way. You know, this allows them to feel more comfortable coming forward, asking for help or asking for a friend. And so the coordination of the programs, and this is what makes the embedded schools program so beneficial, is from the mental health first aid piece that Nona talked about, from the ending the silence piece that Colleen talked about. It's just all interwoven, and our staff, we know, couldn't do it on our own. And so we're always appreciative of the opportunities it opens to help get the students the support they need. And again, whether that's for them or someone else, that they now recognize the signs based on the education that they've been provided.
Great. Sorry. Great. Thank you. So Angie, how do peers aid ROSC in helping prevent recidivism into the justice system? Because we've been talking about youth and collective type things. I want to get a little bit more detail on that. For those that have substance abuse disorders and sometimes the co-occurring behavioral health disorders.
And I would say even in conjunction with like the recidivism for the justice system itself, the ROSC has actually co-launched with the Labyrinth House, YWCA, and TASC, Treatment Alternatives for Safer Communities, the McLean County Reentry Council, to really examine the effect or the residual effect of addiction, behavioral health, or just in general, reentry back into our community for those that have any kind of justice impacted situations. For instance, like a coordinated community response to address prisoner reentry and recidivism. The council is comprised of justice-involved individuals, criminal justice officials, health and human service providers who work together to reduce the recidivism in McLean County. And in order to reduce that recidivism, we need to have the data. We need to understand, why is it a revolving door? What is about the motivation to not go back into the system? Is there social inequities? Is there racial disparities, things along those lines? So we're taking a very strategic effort to kind of disentangle all these interweaving factors to really hopefully to idealize, support individuals and their families who have been impacted by detention and incarceration, to eliminate that permanent punishment. And as a matter of fact, this Saturday, we are having a fully free campaign out at Miller Park to really look at what permanent punishment is, and then what can we do as a community to help eradicate. And that's from 12 to 3 at Miller Park this Saturday.
Thanks. I have another question here. I'm going to go back to Michelle. We like talking about youth. Everybody's not everybody, but there's a lot of people that are very focused on youth, especially in Unit 5 and District 87, since they came back to school full time this year. So in the mental health action plan, we had, is Michelle here? Oh, okay. I just don't see her on my screen.
I show that she's still on, but I don't show her camera up.
All right, I'll pass on that one. I'll see if she comes back, just to make sure that I know she's here. So then let's go back to Nona. So how does mental health first aid help with the trauma initiative too? Because, you know, we talked about crisis and we talked about suicide, but then here we have trauma initiative. So how is that intertwined into that?
Sure. So one of, again, the nice things that mental health first aid does address the idea of trauma. So part of the curriculum does talk about what trauma is, what some potential reactions to trauma can be. Again, most of the time we're thinking kind of typically as post-traumatic stress disorder, anxiety, panic attacks, those kinds of reactions. So there is education on not only what is trauma, but some of those potential reactions as well. And then obviously how to kind of address if you are concerned that somebody has experienced trauma and is having some behavioral health, mental health issues because of that. Again, because this program is evidence-based, it really promotes the discussion of the topic of trauma, similar to Ending the Silence, where just talking about the fact that it exists, talking about the fact that it can be different depending on who you are and various factors in your life, and that kind of thing. And then again, also showing community members that they don't have to know, you know, if they don't have to be able to diagnose someone with a specific disorder. They don't need to know fancy techniques, or they don't need to know therapy. They don't need to provide those kinds of things if they're concerned about someone. They can use, you know, very easy tools such as listening, providing resources, encouraging someone to use the resources they already have, that kind of thing, to all address trauma as well.
Oh, Susan, you are muted.
Thank you. I thought I hit it the right way. I'm going to go back to Michelle and with a real quick comment to see from her about in the mental health action plan, the youth section had tiers and with varying degrees of involvement. So how does the embedded schools project fit into that tier system that the schools use as some of their guiding areas?
So I think as a school system, we operate in that tiered method in how we program for students and how we support them. And so very similar to the action plan, you know, we're really looking for what can we do for all students, and then what are those next layers that they need. And that's where the embedded counselor obviously can't be there to support every single student in our school, but they can be a part of what we do systematically for all of our students. You know, so for example, some of the health education pieces or mental health education pieces that we're doing, they are collaborating with us on that. And then as we look at the needs of the students and then those different tiers, kind of determining what the supports are that kids need individually or that families need individually. and making those decisions based on those levels.
Thanks. I'm going to take some time now to go around and make sure everybody can say how you can either become involved or how they can contact you or get more information about what your topic was. So I'm going to start with Sally.
Yeah, if anybody's interested in being a part of the Behavioral Health Priority Action Team, they can contact me. Susan, I don't know if our email address is going to be shared with everybody after this, or?
I can answer quickly, and just because I'm on the technology side of navigating this too. But for anybody who wants to share their email address, I can put it in the chat box so that it gets pushed out to attendees who are with us right now. So Sally, if the contact would be to contact you through email, then I can make sure that we get that included. If you're willing, so to help with this process, also for people who watch this as a recorded session later, if you would be willing to say verbally your email address, then that will help the folks who watch it later, as well as while I type it. So.
Okay, all right, great. Well, again, the best way to contact me if you are interested in either learning more about this or being on the Behavioral Health Priority Action Team would be to contact me at Sally, S-A-L-L-Y, .gambacorta, G-A-M-B-A-C-O-R-T-A, @carl.com.
Nona.
So the health department, if you look on the health department's website and look for mental health first aid, there should be a list of courses that are going to be taught in the community. If you are part of an organization, a faith group, and you want to register your group for a course for your particular organization, you can also reach out to the health department. McLean County usually helps coordinate those groups and those classes. You can also reach out to me and I can forward any concerns or any questions, that kind of thing, to Maureen. My email address is WALLER @M as in Max, C as in cat, hs.org. That's Waller @mcchs.org. In addition, I am part of the Embedded Schools program. So if you have other questions that Michelle either isn't able to answer or she might forward things to me as well, you can also reach out on that topic as well. I hope I'm not stealing your thunder too much, Michelle, there.
Thank you. And I believe that in the sidebar for the attendees that are live now, there are 2 PDFs on mental health first aid, the one for older adults that's going to be offered in November, and then the schedule for the rest of this year that's going to be offered. So anybody that's watching right now can see those, and those will eventually also be put, I believe, up on the website, the county website, under this presentation for the ones that are not here. Next, Colleen.
So really the best way to get involved in what we're doing with Ending the Silence is to talk directly to the kids in your life. So in terms of participating in the program, we do accept some volunteers at certain times who might be able to assist with some of our tasks. And we also have interns. So if you know a college student who is interested in this kind of programming, send them my way. But in general, if you can start one conversation this fall with a young person that you care about, that's going to have a huge impact. People often send me questions or concerns, things that they're trying to figure out how to address with their child or someone in their life that they care about, you're also welcome to do that. Kids can reach out to me directly. Parents can reach out to me if there's anything I can answer for you or help you navigate. So my email address is coconnor@projectoz.org. So that's COCONNOR@projectoz.org.
Thank you. Michelle.
So I think Nona kind of hit on it. If there are general questions about embedded schools, I really think she's going to have a ton of knowledge to share. But when it comes to specific to Unit 5, I would say starting number 1 with the principal at each child's school is a great place to start, just to ask, like, is this something you have? And how do I get these services? Because unfortunately, we don't have it in all of our schools, but the ones that don't have it know how to connect to other resources, because Center for Human Services supports us even outside of our embedded schools. So, but specific questions that they also have about how it works and what it looks like in Unit 5, I'm happy to field any questions. And so my email is lambolmm@unit5.org.
Thank you. And I want to add that our rural schools are Olympia and Ridgeview that are participating in this program. So any viewers that are watching, if you happen to be in those districts, they also have an embedded counselor in those schools. So I would start with their principal in the schools there. So, or with Nona, at least in Olympia, Nona. And I don't know the person that's in Ridgeview.
Any rural school, if there's general questions, I can probably answer and or guide them to the appropriate person to talk to for sure.
Yep, thank you. Angie.
Hi, so if anyone has a passion for addiction recovery for themselves, for a loved one, family member, or for the community in general, they can reach out to my email is acchasensky@chestnut.org, or they can visit our Facebook webpage, which has a lot of great events going on, a lot of different stories, things along those lines, and I don't want to misspeak, so let me clear up my paper, and that is at McLean County Recovers. That'd be at capital MC, capital LEAN, capital COUNTY, and then capital RECOVERS. And then one more social media platform we are on is YouTube. We have created a YouTube channel again to have that human connection. And so if you want to, peruse for testimonials, if you want to reach out to me to present your own story, record your own story to upload to the YouTube channel, there's a financial monetary stipend I can offer you. And that is, our channel is, sorry about that, McLean County ROSC/YouTube. So there's space between each one, McLean space County space ROSC/YouTube. Please reach out to us in any of those different avenues and we'll get you connected.
Thanks. Tricia?
So if anybody has an interest in becoming part of the planning group for the countywide trauma-informed and resilience-oriented initiative, I would have you email me. It's tricia.malott, so it's TRISHA .MALOTT @McLeanCountyIL.gov. And I'm going to put that in the chat as well. And we can get you connected to the large group. And if you have particular expertise that fall into one of our subcommittees, there are lots of ways to participate and be a part of the bigger group. And then there will be other initiatives that come out along the way for ways to be involved and stay up on education as we move forward with the process.
Thank you. And from the Mental Health Action Plan, please read the 2015 plan, and then when the update comes out, which will probably be the 2021 mental health action plan. Read that. There might be ways in there on how you can get connected because of all of these people here today. We'll have information in there about their programs and initiatives. So I think with that, Kevin might be coming back. Is this time for Kevin to come back?
I'm here. I've been here the whole time. You ready for me? All right. So we just have one question so far, and it's addressed to Michelle, but I believe Colleen may also be able to answer this. It is, how young are the students who are engaged in ending the silence or a similar effort?
So I can grab that one. So we start in the first year of junior high school. So at the vast majority of schools, that is 6th grade. At the schools where junior high starts at 7th grade, then we start at 7th grade. And we start at that point because we want them to know in their first year at this new school, not just, the information about warning signs and what to do, but who are your resources at this school? So we introduce the school counselor. Sometimes they're even able to join us in the classroom. Sometimes we just describe how they can get a hold of them. And we want them to know as soon as possible that there are people at their school who will be there to support them if they are struggling with one of these things. So usually that's around 10 to 12 in terms of how old they are.
Okay, great. So I'd like to remind everyone now viewing today that if you do have questions, please go ahead and put those in the question box. While we give people a couple of more seconds, I would like to say that our presentation from earlier today, Healthy Mental Health in a World of Uncertainty, is now live on our YouTube page, and the PDF is also available on our events page for the website. Both of those will be linked in the chat here right now. And you can look at all of our videos, not just from this year's sessions, but from last year's forum as well. There are over 20 videos out there for you to watch on mental health topics, and I encourage you to go out there and take a look. Well, looks like we're not getting any other questions, so I think that's it for me.
Okay, thank you. And I do want to point out, since there was a question about ending the silence, that is on our YouTube channel from last year. So any of the parents that want to know what their children are going to be taught, that they can watch that video so that they'll be understanding what the students are learning. So I think I think it's really great that we have those videos from last year, the pandemic, instead of being in person. Sometimes you like that in-person activity, but then I think we can go back and utilize and keep reinforcing what we've already done. So
can I share some extra information about that, Susan? So we have two kinds of ending the silence that are on the YouTube channel. So the one for students is the high school curriculum. There's the junior high school curriculum is different because it's more of an overview for the younger kids. So there's the one for the high schoolers, and then there's also one called Ending the Silence for Families, which is directed at people who are caregivers for children. So that provides a lot of information about how you can support your young person if you have concerns about them. So the one piece is for the kids and the one piece is for people who care about kids.
It looks like we did have one other question roll in here, and they're asking, is there overlap with the local child welfare system and community mental health initiatives? It's not addressed to anyone in particular, so whoever wants to answer that, please go ahead.
I don't think so. I think Tricia, maybe you might have a little bit more, or Nona, on that issue. I don't think so, because I do know that some of the providers that we have work with the child welfare system and are involved with that, and they are part of some of these initiatives that we're doing too. So Tricia, maybe.
So and Nona can chime in too. I was going to start from a fairly general perspective and say that a lot of the organizations that are involved with the child welfare system that are providing services to either youth in care or involved with the child welfare system are involved in these other initiatives. So, for one reference point, the Behavioral Health Coordinating Council is comprised of 20 to 22, because I don't remember the exact number off the top of my head, leaders from different organizations, and that includes the Center for Youth and Family Solutions, that includes Project Oz, it includes the Baby Fold, and a host of others that represent individuals involved in the child welfare system. When we talk about, ending the silence as one other example, and that's being presented in the school system, that's inherently capturing youth who are both not involved in the child welfare system, but also youth who are involved in the child welfare system. The similar, so I'm sort of talking for a number of different folks here just because I have sat in on so many of these different meetings over time. But with the CHIP and CHNA, again, those leaders or those staff members from different organizations who are having an overlap with the child welfare system are also bringing their voices to the Behavioral Health Priority Action Team. They are bringing their voices to the Trauma-Informed and Resilience-Oriented Initiative. So it may not necessarily look like a specific point being addressed to the child welfare system, but the agencies, entities, and individuals who are working in partnership with those youth and families are inherently and automatically part of all of these initiatives and discussions as well. So hopefully that gives sort of a broad overview that answers the question, as well as some specific examples about how they're linked.
And a lot of these initiatives are also trying to look at earlier interventions and prevention measures so that it doesn't manifest itself to needing very high intensive services and needing, inpatient hospitalizations and incarcerations and things like that, and trying to actually intervene early as much as possible. So that's hopefully the really long-term goal is to do everything prevention-wise and not have to work, not have the things at the very end. So anything else, Kevin?
No, that's all we've got.
Okay, I want to thank all of our presenters today, and it will be up on the YouTube website. And I want to thank everyone for attending and taking time out of their day today. Thank you.